Let's take an in-depth look now at the human effects of the latest surge in COVID. Louisiana has the nation's highest per capita infections, driven in large part by the extremely contagious Delta variant. At the same time, Louisiana also has one of the country's lowest vaccination rates. This week, Governor John Bel Edwards reimposed a statewide mask mandate for all indoor settings. William Brangham and our team were given special access to one hospital, Baton Rouge General, as staff there try to save lives and to convince more people to get vaccinated.
So we've got 59-ish, fixing to be 60 ICU patients. Of those, 47 are COVID positive.
Each morning at Baton Rouge General Hospital begins like this.
Yesterday was incredibly busy. We went from 39 to 47 COVID ICU patients.
Dr. Stephen Breer, the chief of critical care, briefs the hospital's division chiefs on the latest COVID numbers.
One other thing that, and this is ugly, I hate to talk about it, we need to expand the morgue. You seem to be having some trouble with that.
Right after, Dr. Breer is back upstairs in the ICU. Just over a month ago, there were 10 COVID patients in the hospital. The day we visited, there were 129. It's a surge that's caught Dr. Breer somewhat by surprise.
I thought we were close to done. I knew Delta was going to be a little bit of a surge, especially in Louisiana, given our low vaccination rates, but I had no idea that the impact would be almost as severe as the first surge that we saw.
More than 60% of people in Louisiana are not fully vaccinated, and that's overwhelmingly who's ending up in this hospital with COVID. Of those 129 hospitalized COVID patients, nearly 90% are unvaccinated. And doctors here believe, in part because of the Delta variant, patients may be getting sicker faster.
We're certainly seeing a group of people, not all of them, but a group of them in the ICU who rapidly deteriorate. So people that we would have thought we would have been able to support without a ventilator for a week or two to get them through it, we're running to the bedside to intubate them 24, 48 hours into the hospitalization.
That fast?
Yes, sir.
Seeing this large number of unvaccinated people coming through your doors, is that frustrating to you? Does it you just think that's just the way our society is? Like, how do you square that?
I try not to dwell on it too much.
Why not?
Because it does frustrate. There is a little bit of we shot ourselves in our foot. I'm not mad at people who didn't vaccinate, and I understand a lot of it. I mean, there was so much misinformation out there, and the country is so polarized.
So it affects you personally, you don't know. Now I know.
In one of those in-demand hospital beds is Robert Wilson, a 49-year-old who contracted the virus last month. He wasn't vaccinated.
Wasn't political. It's just, I didn't figure I was going to need it. Because nobody really knows the long term of this vaccine. People are scared of it.
So that was your concern, that you might take the shot and it might harm you long
Down the
term.
road, we don't know. And that's most people's stance that I know. But if it combats this, I'm going to get it this go around.
Because of his brush with the virus, Wilson says his family is planning to get vaccinated too. 32-year-old Jordan Miller is an ICU nurse. She's been here through the whole pandemic.
How we feeling?
And she says for her, this is the worst yet. Staff are tired, burned out, they're working overtime, and she says too many people don't take the virus seriously.
It's something that could have been prevented, and that's what's so hard. And because these people are younger and healthier, it hits even harder. You know, I had a 34-year-old patient that I was talking to, communicating with, having a discussion about his family, and then within 4 hours, he coded and died. 34 years old, no medical history.
Unvaccinated.
While the unvaccinated are the lion's share of hospitalizations and deaths, here and nationwide, that's not true for all.
Yes, I had my vaccine in January and February. And I just started feeling it bad a couple of weeks ago.
70-year-old Rita Eames said she did everything she was asked to do to avoid COVID, including getting her and her family vaccinated. Nevertheless, she developed a rare breakthrough case a couple of weeks ago.
I think my eyes are much better. That means I have any vaccine. If I had to do it all over again, I would do it all over again.
So what could we have done as a population to decrease her risk of being in an ICU for her 5th day now? And what we could have done is the rest of us could have been vaccinated, because we know if we're vaccinated, we decrease the probability of catching it ourselves and transmitting it to someone like Miss Eames.
Louisiana's low vaccination rate applies to medical staff as well. At Baton Rouge General, about half the hospital staff have not taken the vaccine. One of them is surgical tech Ashley Lanou. She spent much of last year recovering from breast cancer and undergoing chemotherapy.
I was very unsure about it just because it was thrown out so quick.
I mean, they developed the vaccine so
Yeah.
quickly, and that made you nervous.
Yeah, I mean, it felt very rushed. Like, why did you all of a sudden come up with a vaccine so quickly for something that just came around?
Well, they would say it's because over 600,000 Americans died, and we've got to stop those deaths. That doesn't persuade you?
No.
Then 2 weeks ago, Lanou got COVID and ended up at urgent care needing an infusion of monoclonal antibodies. That experience pushed her closer to getting the vaccine, but not fully.
On the yes side, but I'm not 100% yet. I mean, there's a lot of people even around here that have questions about it and the uncertainty just with the employees.
This week, another major hospital in Baton Rouge, Our Lady of the Lake, said it would now require its employees to get vaccinated. Baton Rouge General says it's not quite ready for that step.
I do think that mandating vaccines would be helpful when it comes to increasing the vaccination rate.
Dr. Marcel, this is what we have this week.
Pediatrician Dr. Dawn Marcel is the public health director for the region that includes Baton Rouge. She works with hospitals, clinics, the National Guard, and many others to increase COVID testing and vaccination. She says in addition to more mandates, this surge in cases and deaths is already motivating some to change their minds about getting the shot. The state saw a 4-fold increase in first doses received in the 6 weeks from mid-June to late July.
We have seen increased traffic at our parish health units across the state. People are calling now like they were at the very beginning of vaccine availability. So we are seeing a definite uptick in interest in vaccines and people getting vaccinated.
Back on the ICU floor, staff have already built 2 additional units and are planning on a third.
You're already down to 80% oxygen, and I'm going to decrease it some more.
Dr. Breer, Nurse Miller, and the other staff are stressed out and stretched thin, just hoping more people will hear their pleas to get vaccinated.
Do you think if I come back here 6 months from now, we're going to still be having this debate?
I didn't think we'd be here today, 6 months ago, when we knew that a vaccine was fixing to be available to us. So I don't know.
The COVID surge here isn't expected to peak until mid-September. For the PBS NewsHour, I'm William Brangham in Baton Rouge, Louisiana.